I'm Carol Celine, talking with head and neck surgeon Dr. Joseph Curry. Now, you deal primarily with head and neck cancers. What problems do people come to see you for?
Well, we see people with problems in several areas of the head and neck, including cancers of the upper digestive tract, like the throat, the voice box, or the tongue, as well as disease of the salivary gland and disease of the thyroid as well, and parathyroid disorders.
Now, when you're sitting with the patient, you have to help them decide between having radiation or surgery?
Well, at times, a patient may have either option for treatment for their disease. So sometimes surgery is the best option, sometimes chemo and radiation, or radiation is the best option. We try to help walk them through what we think might be the best way to go to optimize their quality of life through treatment and afterwards.
And what would be the advantage of radiation or the advantage of surgery?
Well, at times we can offer surgery with a minimally invasive approach compared to more traditional approaches. This may mean that they have fewer side effects from treatment in terms of difficulty swallowing or difficulty breathing or otherwise.
What are some of the advancements in head and neck surgery today?
Well, a number of advancements have been made over the past several years, including things such as transoral robotic surgery, where we can take the robot that was developed for abdominal surgery, the Da Vinci robot, and apply that to surgery through the mouth to remove a tumor, which can enable us to avoid large incisions or complex reconstructions and facilitate recovery, such as improved swallowing.
Does it help you get into places where you couldn't reach before and that you can't see?
Definitely. There are times where you would need an open incision to expose the voice box or the throat, whereas with the robot we can see into small spaces and around corners that we couldn't do before.
I heard recently that throat cancers are on the rise. Is that always due to smoking?
Well, it's interesting. Traditionally, throat cancers have been related to smoking and tobacco use, which builds up over time and presents in the ages of 60s or 70s. But in recent decades, we've noticed that younger and younger patients are presenting with throat cancers, and they're also non-smokers. Those cancers have been identified in many cases to be related to the HPV virus, which is the same virus that causes diseases like cervical cancer. We think that the mode of transmission is likely related to oral sex, and some evidence is showing that to be the case.
Wow, you taught me something I didn't know. Thank you very much for coming in.
Thank you.